Hello and welcome to this presentation on vibration plates, breathwork, and yoga. What's the research for lymphedema and lipedema? So my name is Kathleen Helen Lisson. I'm a lymphedema therapist. I'm board certified in therapeutic massage and bodywork. I'm a health coach and a yoga teacher. I'm also co-author of the Standard of Care for Lipedema in the United States document and the author of Stress Reduction for Lymphedema. So let's get right into the topic. It's a hot topic. I get a lot of questions about it on social media from my clients. What is the big deal about vibration plate exercise? So let's look at the research behind this. We'll start by looking at guidelines from our different places in the world. This is the S2K guideline, lipedema, and they have a strong consensus of 100% that the vibration plate may be used with the aim to increase the pressure pain threshold on patients, people who have a lipedema diagnosis. And what about lymphedema? The study Etiology and Treatment of Cancer-Related Secondary Lymphedema states that vibration plates can also increase decongestive effects of exercise, but there are many specific precautions that should be observed. And we'll look a little bit more about those precautions later in this presentation, because there definitely are several precautions for using a vibration plate. So, but first, let's kind of take a step back. What is whole body vibration? And I love this illustration that I have to the right of this slide. It's a poor little honeybee and it's in the water, but you could see that the movement of the wings is making a vibration on the water, and you can see in the surface of the water the effects of the vibration. So the vibration is not just on the plate itself. When we ourselves put parts of our body on the plate, that vibration transitions into our body, just like the vibration of the bee's wings transitioning into the water here in the picture. So whole body vibration technique involves standing and holding positions or performing prescribed exercises on a platform that is vibrating at a programmed frequency, amplitude, and magnitude of oscillation. So it is kind of, the devil is in the details. The vibration plates, there's so many different ones. Each one has so many different settings. That is something that individually should be arrived at through a discussion with the person and their provider based on what they want that vibration plate to do for them. So let's look at some things that vibration plates can do for people when we use them. Whole body vibration has been shown to have an important role in increasing neuromuscular performance, improving muscular strength, balance, gait mechanics, and quality of life. So whole body vibration is not just used for people with lipedema and lymphedema. It's used after the space program. It's used in athletes. There's all different types of people who are getting up on the vibration plates for its benefits. So how exactly does whole body vibration work, especially for our clients if you're a clinician that have lipedema and lymphedema? So whole body vibration mediates hypersensitivity through fibers, the thermal sensation in a chronic pain model. This is the title of the study that has found that there's touch pressure mechanoreceptors and C fibers. This is in your skin, in your body. They are highly affected by vibration, and that vibration could be used to decrease the perception of pain, pain perception, similarly to a transcutaneous electrical nerve stimulation device or a TENS device. A lot of us are familiar with seeing a TENS device and seeing how if you apply a TENS device to someone afterwards, it affects their perception of how much pain they have in that area. So these researchers said that studies using passive vibration in humans showed that the use of high frequency vibration directly to the location where the pain was perceived reduced the sensation of pain in about 70% of individuals with chronic and acute musculoskeletal pain. So it's not just the vibration plate. I have tiny tools that are vibrating tools that I have in my office as a lymphedema therapist, that if I apply them to someone after surgery who has pain, they will feel a decrease in their pain. And it may really be by the effect that these touch pressure mechanoreceptors and C fibers are highly affected by vibration. And the vibration that when we apply is used to decrease the pain perception in the skin, in the tissue. Whole body vibration also has an effect on bone mineral density, muscle mass and strength, proprioceptive function, agility, and the development of age-related cognitive disorders. And I have this image on the right of the lady, and she's doing some exercise. This is a lot of the same goals as people have with exercise. Whole body vibration, we're seeing some similar effects. The body vibration has an effect on bone mineral density, on muscle mass and strength, proprioceptive function. So how is your body, where is your body in space? Knowing that agility, which is important for our clients, especially if they have impaired gait. And it seems like everyone's concerned about the development of age-related cognitive disorders in this day and time. So let's get down to specific research on lipedema and lymphedema. So vibration and lipedema. This is from these S2K guideline lipedema document. The vibration plate may be used with the aim to increase the pain pressure threshold. So we just learned a little bit about how vibration may be affecting the pain pressure threshold in our clients. And pain is a major symptom of lipedema. It's something that is affecting the people's quality of life who are coming to us. So they can use the vibration plate maybe to see if they use it and their pain perception pressure threshold, they feel less pain with the same amount of stimulus. That may be an indication that the whole body vibration is working for them to help them reduce their symptoms. And the S2K guideline was developed on the initiative and under the German Society of Phlebology and Lymphology leadership. And this guideline aims to optimize the diagnosis and treatment of lipedema. So researchers using a vibration therapy mat, so this is different from the plate that they stand on or sit on, but it's great research into how vibration might affect people with lipedema. So they had a vibration therapy mat, and they found that combining MLD with vibrotherapy treatment drastically enhanced the effectiveness of treating lipedema. So what about vibration and mood? And this was an interesting study, a very recent study, so I wanted to pop it in here in a slide. And these researchers found that the best results related to mental recovery after intense physical activity are obtained from vibrotherapy treatments of this certain hertz of frequency, 2 to 52, conducted in any position and lasting 10 minutes. So it's interesting that they found a link between using vibration after intensive physical activity and seeing that mental recovery happen. So let's look at the effects of whole body vibration training in aging adults. This was a systematic review. It was from back in 2009. And they found that they were looking for a lot of things, but I pulled out the part of the study that talked about adverse events because we need to see if our clients are coming to us and wanting to use whole body vibration. Are they coming to the next session with us, the next appointment with us, and talking about potential side effects of using the whole body vibration? So 6 studies reported no adverse events from using this. Again, this is in aging adults. Other studies reported minor side effects, including transient itching and erythema. So that's very important if we're always focused on potentially getting cellulitis and any other infection as it starts. Know that maybe sometimes you may find itching and erythema from using whole body vibration. So just to understand that that might happen. They also found muscle soreness, someone having a headache, pain in their forefoot, pain in their groin, fear, and pain in the knee. But the researcher said of these side effects, only the itching and the erythema and the muscle soreness were reported by more than one person. So these are the more often side effects, even though they're rare and they're not very intense. But they did see that the symptoms did resolve within 3 to 10 sessions. And that is the biggest question that I have when people ask me about using whole body vibration is, I'm feeling itching, I'm starting to get itching. Is this natural? What's happening to me? And just to know that for a long time, we've known that transient itching is a potential side effect, a minor side effect of using whole body vibration. There are absolute contraindications to using it. So not everyone can use whole body vibration. And I am going to show you over the next couple of slides a laundry list of cautions and contraindications. It's very important to understand who should not be using whole body vibration because it's not harmless. So absolute contraindications, according to this study in 2023, if someone has a cardiac pacemaker, if someone's pregnant, if someone has cemented joint implants, do not let them use the whole body vibration. Now let's look at another research from back in 2010 with a lot more considerations. Whole body vibration may be considered harmful in people if they have, again, pregnancy, acute thrombosis, serious cardiovascular disease, again, talking about the pacemaker. If they have recent wounds from an accident or surgery, so this is very important because people will want to use whole body vibration right after their surgery to try to reduce the swelling, and we need to understand if this may be helpful to them or harmful to them. So if they still have these wounds, whole body vibration, jostling everything around when it's trying to heal might not be the best idea. If they have hip and knee implants, again, with the cemented implant contraindication. If they have acute hernia, discopathy, spondylolysis, severe diabetes, epilepsy, a recent infection, severe migraine, a tumor, a recently placed intrauterine device, metal pins or plates, not a good idea when the body is healing to expose it to this intense vibration. If they have kidney stones, if they have organ failure, and if they have any clinical conditions in which whole body vibration is not indicated. So this is your big laundry list of things to think of when someone comes and asks you, should I use whole body vibration? So let's look at what Physiopedia says. Physiopedia states that the following are contraindications for whole body vibration. If they have a stress fracture, if they have neuropathy, if they have fibromyalgia, which is interesting because that might be something that someone would say, could this help my fibromyalgia? Again, if they have epilepsy, if they have pregnancy, recent surgery or joint replacement, metal pins or plates, if they have pacemakers, if they have areas that already have a skin rash or open wounds, like we talked about previously, hypertension or risk for clotting. So there's a lot that we see in several different sources that are definitely things to watch out for our clients if they want to start experimenting with using whole body vibration. So there are some benefits to whole body vibration. Let's look at the effect of whole body vibration on lower extremity skin blood flow. And again, these are normal subjects. And they found that decreased microcirculation of the lower extremity integumentary system and peripheral nerves has been reported as a complication of the aging process and a consequence of disease processes such as diabetes. So that is something that we know as you age, if you have diabetes, it's going to affect the microcirculation. And they say that therefore any intervention that increases microcirculation may be clinically relevant. So if someone has diabetes, if they are aging, this is something that they can potentially try to increase this lower extremity skin blood flow as a result of the vibration coming into the body in the feet. And let's look at a little bit about why whole body vibration may be effective. And these researchers were looking at nitric oxide. So they state that a logical explanation might be that the mechanical vibration forces on endothelial cells have their effect due to friction at the cellular level. So this whole body vibration might be causing this beneficial friction at a cellular level on the endothelium, which is the cells are in the lining of the vessels. Another vibration study concluded that increased blood flow was due to significant increases in nitric oxide. So increased nitric oxide produced by an increase in endothelial nitric oxide synthase due to the increased endothelial nitric oxide synthase messenger RNA expression and the eNOS promoter is a direct function of the pulsatile shear mechanical forces to the endothelium. So again, that shear, that friction at the cellular level to the endothelium lining of the vessels may cause increased blood flow because of the increased nitric oxide in that area and what nitric oxide does as a benefit. Let's talk about bone mass and vibration. This is actually how I first found out about whole body vibration because the adding vibration to the body can help the body signal itself. It needs to increase the bone mass, especially if someone is not on their feet using the natural gravity to help increase their bone mass. The whole body vibration can help them. And this study from way back in 2005 states that plantar vibration serves to significantly enhance peripheral and systemic blood flow, peripheral lymphatic flow, and venous drainage, from which may account for the apparent ability of such stimuli to influence bone mass. And then you see what they just mentioned when they're looking at bone mass, but they're mentioning it affects lymphatic flow, it affects venous drainage as well. So let's look at blood pressure and yoga on the vibration plate. This is now we're kind of stepping into my idea, what I want you to really consider, which is not only are your patients may be using vibration plates, but what are they doing while they're on the vibration plate? Are they going to get more bang for their buck if they are doing things like yoga and breath work on their vibration plate and movement practices rather than just kind of sitting there and scrolling on their phone while they're using the vibration? So these researchers found that there was a significant decrease in systolic blood pressure following a bout of yoga on a vibration platform at a high frequency and amplitude. And they think it could be due to a greater activation of skeletal muscle, resulting in the higher level of physiological changes, such as increased local temperature, byproducts, mechanical activity of the muscle fiber, leading to greater levels of vasodilation, decreased total peripheral resistance. So because they're working their muscles with yoga, their muscles are working while they're doing the vibration. So they're feeling the benefits not only of the vibration coming into their body, but their skeletal muscles also working in the vibration conditions. And they concluded that these findings may have a practical application as an alternative treatment for high blood pressure. And future studies should investigate the chronic effect of yoga on vibration platform on blood pressure. This is very, very interesting if you're a lymphedema therapist and you follow me and you have seen how I speak about high blood pressure being an independent risk factor for the development of lymphedema after cancer. So anything that we can do to lower the blood pressure will help the lymphatic system. So it is very interesting how also yoga plus vibration plate may be indirectly, potentially helping the lymphatic system by reducing the client's blood pressure. And we know here in America, 40 to 50% of our clients of the population, the open population, have issues with their blood pressure. So let's look at lipedema, vibration, and yoga. So this is from the standard of care for lipedema in the United States document. And it states that beneficial home exercise plans for people with lipedema include swimming, aquatics, elliptical machines, yoga, stationary bikes, whole body vibration, and walking. and impact levels may vary, but should remain tolerable and sustainable for long-term adherence. And again, you can kind of get twice the benefit if you're doing yoga and you're doing whole body vibration. So let's look into breath and the lymphatic system, because part of yoga is breath work, pranayama. And I'll begin with some anatomy. These researchers share that 60% of all lymph nodes are found right beneath the diaphragm. And the diaphragm is what we use when we're doing diaphragmatic breathing. And so the use of the diaphragm while we're breathing can help affect these lymph nodes. Wang et al. State that studies indicate that following standardized deep breathing, there is a notable immediate reduction in limb volume and edema percentage persisting for at least 30 minutes. Another reason to add deep breathing to your self-care. Diaphragmatic breathing enhances respiratory muscle strength, endurance, and coordination. It improves the chest mobility as we're doing the breathing. It fortifies the thoracic negative pressure capacity because the deep breathing increases the negative pressure in the thoracic cavity. It fosters deep blood and lymph circulation because as we're moving pressures between the thoracic and the abdominal cavity as we do deep breathing, that is helping to circulate both blood and lymph, and thus it is enhancing lymphatic flow. And Loudon et al. Share with us, breathing is an important aspect of both yoga and lymphedema management. Slow, deep breathing with breath retention will create pressure changes to empty the lymphatic system into the venous system at the exit points of the right lymphatic duct and the thoracic duct. So what happens specifically in inhalation and in exhalation, that we should encourage our clients to not just breathe to stay alive, but breathe to help their lymphatic system. During inhalation, there's a lower pressure in the intrathoracic area because we're opening up this area to let the air in. So there's a lower pressure here compared to the abdominal area, which causes the lymph and venous blood to flow from the abdominal area to the thoracic area. So that's inhalation. And then exhalation, there's a rise in pressure in the intrathoracic area because we're collapsing the lungs, letting the breath leave, leading to the lymph flowing into the venous system at the exit points of the right lymphatic duct and the thoracic duct near the medial collarbones. So inhale, we're drawing the lymph up. Exhale, we're putting into circulation. Let's look at lipedema and breath work. What does the standard of care for lipedema in the United States say about breath work? People with lipedema may benefit from postural and core exercises, muscle strengthening exercises, gait training, neuromuscular re-education, and deep abdominal breathing to increase lymphatic flow and stimulate the parasympathetic system. And what about breath work and lymphedema? This is much more widely known. We start our MLD sessions with deep breathing. We'll always recommend deep breathing because in 2020, the International Society of Lymphology's consensus statement underscored the significance of integrating deep breathing training into self-management strategies for breast cancer-related lymphedema. And what about slow breathing? Because I like this 5-5 deep abdominal breathing, but also a nice slow breath. The long, slow breath, researchers say, may improve the elasticity of the secondary muscles of inhalation, such as the serratus anterior, the pectoralis major, pec minor, that can be impaired from surgery and radiation in breast cancer treatment. And fibrous tissue may also be softened by slow breathing, by long, slow breathing that is really using these accessory muscles, the secondary muscles of inhalation, and expanding them slowly, stretching them, and then contracting them slowly. So the conclusion, the use of the vibration plate has been recommended, but for both lymphedema and lipedema patients in research, and we looked at that research, There are many cautions and contraindications. So this is something that you have to, if you are someone who has lipedema and lymphedema, please talk to your expert that you go to for MLD, that you go to for your care, and ask them, arrive at the answer together, whether the vibration plate is something you should be considering for your self-care. And like I said, discuss a specific protocol with your physician or healthcare provider. There are so many questions I see on the internet. What speed, what oscillation, which vibration plate, how long should I be doing it? All this should be customized to a protocol specifically for the patient themselves based on who they are, where they are, what their medical history is, what their goals are, and that is something that your healthcare provider that can work with you on. And vibration may have an effect on all these different systems of the body. You may see benefits in agility and balance. You may see that reduction in blood pressure, an increase in bone mass and mineral density, which we all need, especially women, menopause age and older. You may see improvements in blood and lymphatic circulation. You may see improvements in potential cognitive disorders, improvements in your gait, the way that you walk, improvements in your mood, improvements in muscle mass and strength, your neuromuscular performance, improvements in the way that you can handle the pain that's a part of your life, the chronic pain, and improvements in proprioceptive function, understanding where you are in the world, where your limb is, which really helps with, and then we kind of go to the top again with your agility and balance. So thank you so much for joining me for this presentation. I threw a lot of research at you. This is a YouTube video, so you can feel free to replay it and look at any of the slides, and I'll show you the resources. You can look deeper into all of the studies that I cited. But first, I'd like to offer you an invitation. If you are excited about breathwork and you want to learn more about breathwork, we learned about the benefits of inhalation, the benefits of exhalation, and the fact that breathwork is diaphragmatic breathing is recommended for both lymphedema and lipedema clients, patients. You are welcome to see a free 10-session breathwork and lymphatic wellness class that I recently produced. That is free, and it's at my YouTube channel at Stress Reduction for Lymphedema. And in close, I'd like to thank you for watching this presentation. I hope this answered a bunch of your questions and gave you a lot more questions and got you excited in learning more about potentially having vibration plates as part of your self-care and asking your lymphedema therapist about which vibration plate may be right for you and what are the risks and how you should potentially proceed. You can find my yoga, breathwork, and vibration plate exercise videos at bit.ly/vibration plate yoga. So I have a vibration plate. I have seated routines, which are great for beginners, and it's set to that 10-minute session that I have for my vibration plate, that we do a little bit of deep breathing. We do a bit of movement and mindfulness, some gentle yoga, chair yoga, stretching and movement and twisting as our feet are taking the vibration on our vibration plate. So this would be one potential place to start to see how you could possibly just do a little bit more than put your feet on the vibration plate and scroll on your phone for 10 minutes and check that off as your self-care. So that's a good place to start. You can definitely show your lymphedema therapist some of the routines, ask if that might be somewhere that you can start in your exploration of whether vibration therapy is something that you want to add to your self-care. And if you have any questions, you can leave them in the comments in this video. You can also find me on Instagram at Stress Reduction for Lymphedema. And this is a fantastic picture that was taken by one of my colleagues who's a venous surgeon, as I was teaching the surgeons a yoga class at the V-Wind Foundation V-Windonesia Worldwide Conference in Bali, Indonesia last year. And here are my resources. And I'd like to close by saying thank you so much. I hope this gives you some information you need to have that great conversation with your medical professional about adding or including whole body vibration in your self-care for lymphedema or lipedema. Thanks and have a great day.